right, hello, and welcome to the Change Company's second webinar in our grant writing series on developing a competitive statement of need. I'm Amber Bollinger, Chief People and Operations Officer at the Change Companies, and I'll be your moderator today, along with my colleague David Alviar, who will be monitoring the chat and incoming questions throughout the webinar. After the webinar, attendees will receive the list of data sources that are shared in today's webinar, the community needs assessment template that is also shared today, the list of companies and organizations that you can contact for grant writing and related services, the webinar recording, and an email with a link to our grant writing webinar page. Our presenter for today's webinar is Dr. Rhonda Bohs. Dr. Bohs has an impressive background with over 30 years of experience working in the behavioral health field. As an academically trained researcher, Dr. Bohs identified early in her career that if she was to conduct research and program evaluations in community-based programs, she needed to become an expert in grant writing. Since then, Dr. Bohs has successfully written and or managed more than 300 grant programs from SAMHSA, HRSA, CDC, ACF, Bureau of Justice, Corrections, and state and local grant proposals. In the past 10 years, Dr. Bohs has worked with organizations in receiving more than $500 million in grant funding. Please welcome our presenter for today, Ms. Rhonda Bohs.
Hello, everyone. Happy Wednesday. It's great to be back for another webinar with the Change Companies. As Amber said, this is the second webinar that we've done. The first one was about how to get ready for grants, where to find them, and resources you can use to help prepare you. So if you weren't able to participate in the first webinar, I would encourage you to review that and review those materials, because that will also help you to get ready for this year. Today, we're going to be discussing the development of a competitive statement of need, which is found in all RFPs or request for funding. And before we get started, I just want to do my usual disclaimer that I do not speak on behalf of any federal agency, SAMHSA, or anyone else. What I'm bringing to you is my 30 years of experience in doing this work and the common mistakes and also things that you can do to ensure that your proposal is competitive. Receiving a grant award is a major accomplishment insofar as they have become so competitive that in most cases you need to receive a score on the grant of 90 or better in order to be in the fundable competitive range. And sometimes even 90 isn't high enough, depending upon the grant program. So, I applaud the Change Companies for putting together this series of webinars so that you can get all the tools that you need to assist you in developing a competitive application. Now is the time for us to become prepared for funding, because once funding opportunities are released, you will only have 6 to 8 weeks to develop a competitive grant application, including the budget, all of your letters of support and commitment, everything that you need. And so it's really important that you can do as much as possible before these opportunities are released. Typically, by this time every year, there's a forecast of all of the grants that are scheduled to come out during the federal fiscal year, which started October 1st. However, because of the lack of an approved federal budget, there is very limited forecasts that are coming out. So what may very well happen this year is that rather than forecasting grants, the opportunities will just be dropped. So that even makes, it more, it really emphasizes the need for you to become as prepared as possible before the grants are actually released. Next slide. Next slide. Okay, so today we're going to talk about the statement of need. This is typically the first part of a grant application. The statement of need is it can be a few paragraphs, it can be a few pages, depending upon the funding opportunity. But it is where you are going to describe the specific public or community needs that your organization and your project will address. This is a crucial part of the grant because it helps the funder understand why your project is worth funding. Now, an effective statement of need is going to convey a sense of urgency. It's going to demonstrate how critical needs are currently being unmet or underserved in your community. And it's going to reveal the real world impacts of any unmet needs in your community. It will also provide an understanding of the impact of the problem on those people that are directly affected by the problem, and then the community as a whole. This is where you are making the case as to what the problem is and why your project, as opposed to everyone else's, should be funded. So it needs to be persuasive, it needs to be data-driven, and you are making the case for why your program is needed right now. It can be, as I said, a few sentences or a few paragraphs. It's part of a larger proposal, right? Part of the larger narrative. And so it's going to carry the reader or the reviewer from the need that you're going to have in this statement of need, and then the subsequent parts of the proposal in which you're going to be describing your response to the need. So you'll want to make sure that you are clearly establishing what the issues are that you are going to address, okay? You're going to demonstrate why this issue is in need of funding. You're going to want to support everything by facts and research or data-driven evidence of the problems and the issues. But it does need to be written in a clear, easy to understand manner. People that are reviewing these proposals range from being academics to being program directors, agency administrators across the country, and even peers and community stakeholders and families that have received services. So it needs to be written at a level that everyone can easily understand what the problems are. It also needs to be aligned with what the intent of the funding opportunity is. Typically, in every funding announcement, at the very beginning, there'll be a statement about the purpose of the funding and what the goals of the funding are. So it's important that your statement of need is reflecting what the funder's intent is for the project, and that your program that you're going to be putting together aligns well with what their goals are. Next slide. So the first part is typically the population of focus. This is where you're going to identify and describe your population of focus and your geographic catchment area where services will be delivered. And this needs to be aligned with the intended population that will be the focus of your program. So you're going to need to collect current quantitative data to describe the populations in your community. And the geographic catchment area. This needs to be very specific and concise. If you're writing SAMHSA grants, this is typically one paragraph or half a page, okay? And you are going to be providing the sources of the data that you're going to be including, and it should include minimally a description of different types of people in your community. Racial demographics, ethnicity that includes language and cultural issues, if those are predominant in your community. Gender, sexual orientation, gender identity, age, and socioeconomic status. In SAMHSA grants, if you're looking at SAMHSA grants, and also in HRSA grants as well, the reviewer will actually have little boxes that they will tick off on the review sheet for each of these things. Did you discuss race? Did you discuss ethnicity, sex, sexual orientation, on and on and on? Even if your community doesn't have data on some of these, like some communities don't have sexual orientation data, you still need to put in that it's unavailable, right? You don't want to miss anything that is in the required questions related to the population of focus. You're also, because these populations and the description of the population will lead you to the next section where you're going to be talking about any disparities among populations or who isn't receiving services or what the barriers are to services. So whenever you're looking at data in this population of focus, I'm going to give you some links and we're going to discuss here in a second some of the national websites where you can find some data related to your community. But also you're going to want to look at local data. This may include things of state and county public agencies and data they have related to the issues that you're addressing. School system data, if you are working with children or adolescents or young adults, school systems can provide you with data in terms of incidents, behavioral incidents in schools, truancies, and they usually also have these segmented by race and age and grade level. And so oftentimes what you can find, particularly with in comparing juvenile justice data with and racial demographics of juvenile justice populations with school related data, you can in most cases make a case about the school to prison pipeline where certain populations of students are much more likely to be arrested and suspended from school than receive behavioral health treatment or prevention services. So you're wanting to make the case using your local community data of what the issues are. You can also look at court system data if you're doing something with harm reduction or HIV related services, particularly with people that use drugs. You can look at HIV and AIDS planning councils. They usually have data that's available. Community health assessments that have been done in your community. There's been a lot of these that have been completed since the pandemic. So the data should be relatively new and useful. And now community health assessments usually also include issues related to social determinants of health, which all funders now are making a priority in how to minimize or reduce barriers related to social determinants of health. Arrest data, United Way organizations also have good community level data, and hospitals will also have data that you may find useful. Next page, or next screen. So some of the sources that you can use, and as Amber said, you will get this in a sheet with live hyperlinks that you can click into following this webinar. The first one is the Statistical Atlas. If you go into the Statistical Atlas, you can pull down very specific county and community level data related to all sorts of not only census related materials, but also more into the health of the community and things like that. So that's an excellent place to start. Of course, using census data is helpful. The community survey that the data is presented through the census department is also very useful in quickly putting together this data for the overall population that you're working with. There's a website you can go to get your county's health ratings and see where your county is in relation to other counties in your state or even the country. Sometimes it's good to be able to say that your county has the most unmet need of X, or your county has the highest rate of drug overdoses of the rest of the state. The county health rankings can help you do that. Then in many places, including rural communities, frontier communities, and now in the last few years, even some urban communities. You can go to the HRSA health professional shortage and medically underserved areas. These are determinations made by HRSA, and you can see what the ranking is, how many physicians and nurses, primary health care there is in your community, how many behavioral health workers there are in your community, and they will identify those areas that are in need of more health services because there's just not enough in the area. And if you're in an area that is identified as being one of these underserved areas, that information is very important to put into your population of focus. There's also a National Center for Education Services that can help you find some educational data related to your community. And then, of course, I've provided you with a website that will link you to all of the state health departments' websites so that you can go into your state and then hopefully be able to drill it down to your community. If you're working with children or adolescents, the Kids Count Data Center is a good place to go for some of their data related to the Youth Behavioral Risk Survey and other health-related metrics for children and adolescents. And then there's labor statistics also, where particularly if you're thinking of writing grants to enhance training or to engage workers into your agency, the Department of Labor and the labor statistics can help you with that. Next slide. So following the paragraph or the half a page, if you're doing a SAMHSA grant, on the population of focus. And again, I said this in the earlier webinar, in the first webinar that we did. In SAMHSA grants, you're limited to 10 pages. The section A, which is your population of focus and needs and gaps, is usually 1 page. So there's not a lot of room for you to be able to write a lot of discussion about these things. Typically what you'll want to do is to provide some discussion, but you're going to want to put a table in, and you're just going to list out each of those things that are identified as your population of focus metrics and put them in a table, and then sum it up with what the population is that you are going to be focused on in your program proposal. Then the next section, the last half of the page, will be where you discuss your community's needs and gaps related to the services in the program that you're wanting to receive funding for. So again, you're going to use local data to describe the need and the service gaps, and you'll supplement this with state data if necessary. If you want to, if your needs are the largest in the state, you'll want to say that. If they aren't, and you can establish the need within your own local community data, then do that. Reviewers are more and more looking at what is happening in specific communities that need this, that need these things. You're going to describe the extent of the problem in your community, including service gaps. So again, you're going to compile existing data, gathering and comparing state and local information, and data already collected by individual agencies, including your agency, state and county public agencies, school systems, health systems, court systems. You will also want to look for community health and social service needs assessments. Many hospital systems and public health departments have done these in the last few years. These community health assessments will focus on the local assets in the community, where people are going to get services, where there's large wait list to get services. This is particularly true. I'm seeing a lot of this with respect to adolescent services, the need for child psychiatry, or the need for substance abuse treatment for adolescents, because there just isn't any in the community. So they will also, the community assessments will talk about the gaps of which there are no services, or in which the community has said we need more services, barriers, or emerging needs. So understanding your community will help you tailor your selected strategies and activities that will be your response to these needs and gaps for your specific project and your specific populations of focus. And if a needs assessment hasn't been conducted, then you may think about conducting one yourself. The need has to clearly establish the baselines for your project. The purpose at the end of this section is for you to have documented the extent of the need, including current prevalence rates or incidence data for your population of focus. So look at your internal agency data as well. Now, the needs and gaps is a great place for you to identify opportunities for improvement within your agency. If it takes people several weeks to be able to get in for an initial appointment, then that access issue may be something you want to focus on. Or if the demographics of the community or the people that you serve have a large percentage, say, of Spanish speakers, but within your organization, you only have 2 bilingual staff members, then that may be an area that is a need and a gap. If you look at your dropout rates of people that aren't engaged into services, do those rates, maybe that's an area that you want to hone in on, is better engagement, better evidence-based practices. And if you segment these things by demographics of the clients that you serve, you may find that your outcomes are different for a majority population as opposed to the minority populations that you serve. So these are things that you want to create a clear need that you are going to be responding to. And don't forget in this needs and gaps section to discuss the impact of social determinants of health. If you're working with children and adolescents, discuss education. If your community has a very high unemployment or homeless rate, discuss that. If access to care is an issue, people have to drive for hours to get to your facility, that is a gap. So don't leave out social determinants of health. More and more funders are seeing the impact that these social determinants have and are leaning toward programs that are able to go out into the community and provide these services where the people are, either in their homes, in the schools, rather than having people need to come to you. And the use of telehealth is, that's one of the reasons why it has exploded during the pandemic, and people are still doing it because it really it reduces that access to care issue. Next slide. So what if the data isn't available locally, right? You may be in a rural community, or there's just not the data that you need for your program isn't there. Well, one thing you can do is to conduct surveys with your community stakeholders, with your staff, with consumers and their families that you work with to determine what the needs are. You can use a representative sample of your population of focus. If you are planning a grant that is going to try to increase access and provide evidence-based culturally specific services, say to a community of color, then take a sample of your population that is from that demographic and conduct a survey with them, asking them what things you do really well and what their barriers are to getting services, or what needs they have that are currently not being fulfilled, and then use that data in your needs and gaps. Identify or interview community leaders, stakeholders, decision makers who are knowledgeable about your community and can accurately identify priority needs and concerns. Hospitals and crisis units, detox units will oftentimes be able to tell you what their gaps are in terms of making that transition from the crisis or detox or hospital unit to a community provider. And you can work with them to develop a program as to better make that transition happen. You can also convene an advisory group to discuss the needs and gaps in your community related to the issue that you're seeking funding. You could do community forums and conduct public meetings where you're inviting community members and having a community discussion about the issues and the problems that you're seeking funding for and get their input about ways to address it. If you're working within a criminal justice population, if you haven't done one recently, you may want to think about conducting a sequential intercept mapping workshop to identify the intercepts where criminal justice and behavioral health care comes together to try to facilitate better access and to prevent people from entering the criminal justice system. So any techniques that you choose to use to get this data need to just reflect an understanding and an appreciation of your specific community cultural characteristics and the needs of your population of focus. Next slide. So one of the things that you're going to receive is I've put together a template where I've spelled out all of the different areas of data that you may want to go out and get. And so if you have one location and you're thinking, I want to do a grant for this community, then complete this demographic community health needs assessment where you're plugging in your data. And once you see this form, you'll see at the end of it, there are some qualitative areas where you can, put in what you're being told by your consumers or by community stakeholders as to what the needs are. And so by the time you complete this, you have what you need for at least the next year to be able to respond to any sort of RFP funding opportunity where you're going to have to discuss the problems, your population of focus, and the needs and gaps. So you will receive this template at the conclusion of this webinar. Next slide. So, we've spent a lot of time talking about one page in a SAMHSA grant. In HRSA grants, in CDC grants, these may be several pages, which you can go into much more detail about the data that you're presenting. But whenever you're putting these things together, you want to begin with the end in mind. If you're thinking this year that you want to write for a medication-assisted treatment grant, and you know that sort of population or the evidence-based practices that you're wanting to utilize and why you want to do that, then having that in your mind whenever you're writing the statement of need, it needs to align with your response that will come later. If a reviewer reads in your community needs in the statement, your statement of need, if they see that there is a large percentage of minority populations that are not receiving services, or that the overdose rate is much higher for particular populations, or that people with very specific cultural characteristics are not, because of stigma involved, are reluctant to seek substance abuse treatment or medication-assisted treatment, then if that is all in your statement of need, you don't want to start the next section with, okay, well, now we're going to be taught, our approach is going to be serving Caucasian people that we've been serving for 30 years and we're going to continue serving them, right? It needs to be reflective of what the needs and gaps are. So every section of the proposal needs to build on the section before it. So whatever you put in this section needs to be carried forward in your response, which will be in the next sections of the grant. So is the program that you're wanting to implement, you need to justify it in the statement of need. In the end, your statement of need will contain a description of the problem. What is the specific problem or need that your organization is going to address? And you don't want to address everything. It needs to be very specific about the issues and the populations that you're going to be focused on. It needs to state what the implications are. who is impacted by this problem, and what will happen if the problem isn't resolved. And a sense of urgency and challenges. Why does the problem need to be addressed, and why does it need to be your organization that addresses it? So you want to be able to write the section in a very clear, concise, persuasive, and engaging style. What I tell people is that by the time I read through the statement of need, I should be thinking, wow, this is a really big problem in this community that needs to be addressed. Look at all of these people that are not receiving this service. Look at the problem that this is creating in the community. And if I'm not thinking, wow, this is a big problem, then it's not a persuasive statement of need. Okay. Next slide. And I think now we are ready to take any questions.
Great, thanks, Rhonda. All right, we had a number of great questions submitted at the time of registration, and we'll start with some of those questions, and then we'll look at any that were submitted during the session today. So the first question, Rhonda, is how do I best represent needing additional funding for a partially funded project expanding existing work? So many funders want new work. Should I reframe the next step as new?
Excellent question. Yes, reframe it as new. This is typically, this is an excellent question. Many times you have a great functioning program, it's doing well, but you think, we need to add a family component, or there needs to be a better continuing care component, or we want to introduce more life skills enhancements in this. And so what that would be considered is an expansion, right? An expansion of your model. So it really benefits you to talk about the success you have in your current program, how many people you've served, how great it is, what the outcomes have been. And then because of your experience doing that and the lessons learned, then the gap is what it is that you're wanting to do with this new funding. So you're basically expanding your model. In some cases, expansion means adding treatment slots. In many cases, expansion means that you're adding on another component to an existing program. That's a great question.
Great. Next question, what are you looking for when you read a grant?
Well, as I said, for the statement of need, it needs to wow me. It needs to really clearly describe an urgent need in the community that needs to be addressed. And we have seen a lot of these mental health and substance use related needs in the community, particularly since the pandemic, where we saw alcohol abuse skyrocket, drug abuse skyrocket, and co-occurring disorders, anxiety, depression, coupled with substance use. So I want to see a statement of need that is extremely engaging and persuasive. But then after that, I want to make sure that the goals and objectives of your program, your implementation plan, and your organizational history aligns with those problems that you've identified, that you are speaking to the exact problems that you've identified in your statement of need. That's what I'm looking for, and that you have clearly thought out a concrete plan. Saying things in a grant proposal about, well, we will do this, we're going to add something new and we'll figure it out after we get the funding. No, you need to have a clear plan in place now. That's what I'm looking for.
Great, thank you. Next one, how do I get the donor to understand how the need meets their giving requirements? Sometimes it feels like we are talking two different languages.
Okay, so when using the word donor usually means to me foundation. So it's a foundation proposal that you're working on. If you're working on a foundation proposal, I strongly recommend that you have frequent meetings with the foundation or with the donor to clearly understand what it is they want to fund and what you want to do, and work with them together to figure out that alignment. and then write your proposal. If it's a request for funding from a grant, from a federal grant or a state grant, then what you will want to make sure is that you read that funding opportunity carefully, see what the goals are of the program, and what the intent of the program is, and phrase everything, work everything in your proposal to speak specifically back to those stated intents and goals, so that there is a clear alignment toward what the funder's paying for and what it is that you're proposing.
Great. Next question, has anything changed recently in the focus for funders?
Yes, the focus has shifted since the pandemic to be much more inclusive of integrated care between primary health and behavioral health. So making sure that people have access to primary health care if they're coming to you for substance use disorders or for mental health disorders. The need to recognize co-occurring substance use and mental health disorders and responding to those equally and not having one be the priority. And also the impact of social determinants of health. That has become big. I'm seeing more and more grants that once you get the award, you have to turn around and do a community needs assessment specific to your grant population that is specifically looking at social determinants of health. Because now all of the data that was compiled during the pandemic and everything clearly speaks to we can do the best treatment in the world. But if these social determinants are not addressed, we're going to have recidivism coming back into our criminal justice systems, into our substance use and mental health programs. So responding to those, taking care into the community, not providing services solely in a brick and mortar agency environment, but taking them out into the community is a big focus now, as is the use of peer support for families, for consumers, and peers with the lived experience similar to the population of focus that you're working with. Those are the big areas that I see major highlights and focuses on right now.
Wonderful. Next question, do you have any unique knowledge about how and when opioid settlement funds might be dispersed as grant dollars?
Great question. Well, there are a few websites that if you just Google, opiate settlement funds, that will take you to different sites that are saying exactly how in each state those funds are being distributed. The states received a lot of money from this issue, and so many of them are now putting out funding opportunities related to the settlement money. And so if you visit these websites, they will tell you what the states are doing, and also each state had to develop a plan for what sorts of activities that they would support for use of the opiate money. So it will also let you know what the state is looking to spend, what they're looking to buy, and then you can align your activities with what the settlement money has been earmarked to do. But those are starting to come out now. And so, if you have a website in your state that you can go into every day and check to see if new funding opportunities have come out from the Office of Substance Abuse or the Office of Behavioral Health, then check on those daily because they are coming out.
Great. We have a few questions that came in during the session today. The first being, how often should a needs assessment be conducted? Can you use a needs assessment from someone else that conducted it?
Yes, those are my favorite kinds. You don't want to reinvent the wheel. If you've got a great needs assessment that has been done within the last 2 years, then I would say use it. A lot of them have been released within the last year. So yes, absolutely. Don't reinvent the wheel. And community needs assessments are very time consuming and require a lot of work. And so if you don't have one in your community, please try to determine how you're going to get some of this data. But if you do have them, and reach out to your community partners, to the health departments, to the hospital districts, especially those that are the safety net hospitals, because they have been very good in the last couple of years of putting out that data. Typically, needs assessment should be done about every 3 years in communities.
Great. Next question is, who would the best agency or entity be to propose financial backing for a center that would house as well as treat those that are in need of treatment services for substance use?
Well, there's a number of different places. There are some SAMHSA grants that will pay for recovery housing with a treatment overlay on it. There's also within state departments now, within the states and also at the federal level, there are housing grants specific for this population. So, you know, a lot of times, for example, there's the SAMHSA has the pregnant postpartum grant for women that will pay for residential treatment and for recovery housing once they leave. Unless it specifically says in the grant that you are prohibited from using funds for housing, then propose it. And again, you want to align it with the goals and the needs of the funder that they've stated in the funding opportunity. But there are ways that you can get that paid for. But there are, you know, look at HUD housing, look at recovery housing, transitional housing, and you may need to braid funding together between housing and substance abuse treatment, or you can find most typically a federal grant, sometimes state grants, that will let you do both at the same time.
Great. We have time for one last question. This question is, would it be helpful to include information on recent policies and how they may impact peer support services? For example, SB 326 and the recent measures passed by California, if you have familiarity with that, as an example.
Yes, yes, yes. Those are the, you know, in that needs and gaps section, if you can state briefly and succinctly what those policies mean in terms of services or gaps that's going to develop and how this funding is needed to hit that, or to, you know, to reduce gaps or to increase access or things like that, then definitely yes. Oftentimes with peers, there's an issue related to certification requirements, background check requirements that are very difficult to attract peers into the workforce. And then many times states, Medicaid, whoever the funding sources are, do not pay a living wage for peers. So all of that, those policy issues, new laws, things like that are great for that statement of need. Excellent question.
Wonderful. Well, that takes us to time. Thank you so much, Dr. Bohs, for your insight. I love that what you do is helping organizations get funding for things that they are doing to really make a positive impact in their communities and help those in need. So thank you for your time with us today. As mentioned, we have a new grants page at the Change Company's website that consolidates many of the resources discussed in our grants webinar series, plus federal grants tracking. We'll include a link to the site in our post-webinar materials, along with the other documents and resources that were mentioned during today's webinar, and a link to the webinar recording itself. Thank you all for joining us, and we hope to see you in our next grant writing webinar. Have a good day.